Go ahead.
A very good afternoon to everybody. I'm Dr. Meghana, Clinical Head and Fertility Specialist at HSR Layout Oasis Fertility, Bangalore. And we have Dr. Rekha, who is also a consultant at HSR Layout Oasis Fertility, Bangalore. Today, we both will be discussing about HIV and pregnancy. The way how people can go about trying for their pregnancy, what are the chances of them getting the disease, or what are the methods which we can follow in the hospital and our laboratory to make sure that the disease is not transmitted to the uninfected partner, and also to make sure that to best possible extent to give them a healthy baby who is non-infected. Can we start the show, Dr. Rekha?
Yes, ma'am. So we'll be going through a few questions which will be answered by Dr. Meghna. And I think towards the end of the session, everybody will be able to understand the disease transmission and how safely you can plan your pregnancy when the couple is HIV positive. So coming to the first question, what is HIV?
HIV is a viral disease caused by a RNA virus. When we say RNA virus, nowadays everybody is aware of coronavirus. So the human immunodeficiency virus is also one of the RNA viruses, and HIV and AIDS are not always the same. Though HIV infection starts, and that when it comes to AIDS, it's a full-blown disease with lot of opportunity infections and other problems. HIV is one of the stages of the disease, which then progresses to AIDS. So it's a disease which is caused by RNA virus.
And the recent studies have also shown that around 80% of the HIV infected population belong to the reproductive age group. And among them, there are around 20 to 50% who are planning their pregnancy. So we would like to go a little more in detail about the how safely pregnancy can be planned when the couple is HIV positive. So coming to my next question, ma'am, how does HIV affect the fertility potential of a woman or a man?
HIV affects the fertility potential of the couple at various levels. At the first level, it is a stigma associated with the HIV itself. When the partner gets to know that her partner is infected and she or he being not infected, there is a stigma surrounding this person, and the general perception is that even if you touch that person, you are going to probably get the disease. In that case, they usually avoid having the intercourse itself. So that is one of the ways. Abstinence is one of the main reasons why they end up being childless, or they might not even plan for their fertility potential. First thing. The second thing is there are a lot of do's and don'ts surrounding these couples when they are sero-discordant couples. That means when I say sero-discordant or sero-concordant, discordant is in the sense when one couple, amongst the couple, when one individual is affected and the other individual in the partnership is not affected. So then it becomes difficult for them to have a regular unprotected intercourse. So that is one of the reasons why they might not be able to achieve their fertility potential. The second reason could be that because of being HIV positive, there is a suppression in their immunity levels. They are immunodeficient or they are immunosuppressed, because of which they are more prone to the opportunistic infections. And this itself, that means they could be more prone to vaginal infections, they may be more prone to pelvic inflammatory diseases, due to which there is a higher chance of them not being able to have regular intercourse, protected or unprotected otherwise. And this also can be one of the reasons why they are unable to conceive. And coming to the parameters wise, yes, there are certain studies which say that a woman who is infected with HIV can also have a reduced ovarian reserve. That means when the ovarian reserves, or the number of follicles in the ovary, reduces, their ability to conceive also reduces to a certain extent. This could be the third reason why these women find it difficult to conceive. And again, even when in a sero-discordant couple, that means one of them is infected and the other is not infected, they are allowed to have unprotected intercourse only around the fertile period, which can vary in lot of individuals. So that means not being able to have intercourse at the right time could also be one of the reasons for them not able to conceive. So these are some of the problems which these couples face when they are planning to have a pregnancy.
Okay. So coming to the next question, ma'am. Um, How do you think assisted reproductive technology can help these couples?
Okay. So one of the ways, or one of the healthy ways, or the ways where the infection can be reduced by being spread from one couple to the other in a zero discardant couple is through assisted reproductive technology. So when we say assisted reproductive technology, it doesn't involve only IVF. It can be IUI, or it can be a timed intercourse which is timed so well that the couple who are zero discordant can also try naturally. The other one is either IVF or ICSI. So when we come to the question of, let us start with the easier methods first. A protected intercourse under supervision or unprotected intercourse under supervision. So most of the times when a couple is zero discarded, that means one partner is infected and the other partner is not infected, we usually advise them to have a protected intercourse. That means they are using protection in the form of condoms most of the times. So, in a couple where the infected person is under the antiretroviral therapy, is under treatment for HIV, and we find that his viral load is very less. When we say very less, it should preferably be less than 200 copies. At that time, the uninfected partner is also on the pre exposure prophylaxis. That means there is a risk of getting infected, and this person has already started the treatment to prevent the infection. Under such circumstances, they can have unprotected intercourse around the time of ovulation to maximize their chances of a natural conception. This is one of the methods. But to reduce the risk further, the better option is to go for either an IUI or an IVF, depending on the other parameters. In both, whether it is IUI or IVF, we need to make sure that the semen sample is well prepared. So even if at all they are planning to try for assisted reproductive technology in the form of IUI or IVF, then the infected person needs to make sure that they don't have any opportunistic infections at that point of time, no infections in the genital area particularly, then their otherwise the general health is good, the viral load is less than 200 copies per ml, their CD4 counts are normal. So these are some of the things which as a reproductive endocrinologist or as a person dealing with infertility, we also have to liaise with the infective diseases specialist to make sure that this couple are good to go ahead with a fertility treatment. So what we do is basically we ask the person to collect the semen sample, then the semen sample is processed. Usually in an IUI, even in an otherwise normal couple who are not having any disease, we do process the sample and do the IUI or IVF. Here, double care, extra care is taken to make sure that the sample is well prepared. So basically, we either do a triple gradient method or we do a density gradient with a swim up method to make sure that the semen is free of the disease. So any semen sample in a person who is HIV positive, there is a 5%, or rather to be precise, 5.3% chance that the semen sample might contain HIV. But it is very unlikely that the HIV virus present in the semen sample can get on to the sperm because it is usually impermeable to the viral disease. So the chance of the sperm containing the disease is much lesser compared to the semen sample. So in that sense, we usually say ICSI is more specific to the HIV disease compared to IUI or IVF, where we leave the sperm surrounding the oocyte. In the ICSI, what we do is we usually take one oocyte and put one sperm into the egg. So that means since the sperm doesn't usually carry the infection, it is much safer to prevent the spread of infection to the uninfected partner and also to the unborn child. But still, there is a minimal risk of this couple ending up having the disease. So in cases whether they want to go through IUI or they want to go through ICSI, it is always better to have the uninfected partner on pre-exposure prophylaxis.
Coming to the next question, ma'am, every couple will be scared whether they will transmit this infection to their unborn child, even though they are undergoing the artificial reproductive technology and getting pregnant. So, are there any methods by which we can prevent the transmission to the child during pregnancy as well as after delivery?
Okay. Now let us talk about serodiscordant couple where the man is infected and the woman is not infected. When the man is infected and the woman is not infected, taking the opposite measures during the semen preparation will, to a very great extent, reduce the risk of transmission of the disease to the woman and her unborn child. But still, we have to make sure that the woman who is going to receive the sperm, either through IUI or through IVF from an infected person, has to be on pre-exposure prophylaxis. Now, coming to a zero discarded couple where the man is uninfected and the woman is infected, she needs to be on the medication, on the antiretroviral therapy, and the same parameters which we discussed just now applies to the woman before she plans for an ART treatment. Along with that, we what I mean in a couple who is not on antiretroviral therapy where the woman is HIV positive, there is a risk of transmitting the infection as high as 20% to the unborn child. This risk reduces to approximately 5 to 8% when we make sure that all the other parameters are taken care of. And we have already decided to give the pre-exposure prophylaxis to the child as soon as it is born, which is continued for up to 6 weeks post delivery. This can be further reduced to less than 2% by making sure that all these parameters are taken care of.
Is there is another question now? Is HIV completely curable?
HIV disease per se is probably not curable. So once infected, it is like a hepatitis B infection also. Once infected, the infection remains within the body. But we can make sure that they don't progress into full blown AIDS by making sure that we take care of their general health from the beginning, keep check on the parameters, and once the parameters are out of control, start them on the antiretroviral therapy. Then if at all the infection is not controlled with a single dose, probably we need to go for a combination of the antiretroviral drugs. And in today's era with the modern medicines, it is much easier to keep them under control and make sure that they don't end up in a full blown AIDS. But per se, once a person is infected, it is not possible to make them infection free.
So, as ma'am rightly said, HIV is not completely curable, with the modern antiretroviral therapy treatments as well as with the upcoming ART techniques, they can also plan for a safe pregnancy as well as delivery and also have a same life expectancy as that of the HIV negative people. If any other doubts are there, the forum is open for discussion.
So before we finish the session, this year World AIDS Day is being celebrated today, that is on 1st of December, and the theme is to equalize. That means there should be no discrimination against the HIV infected persons. Like any other infection, like how people got infected with coronavirus, or it can be a hepatitis B infection, or many other infections. This is also one of the infections, but there is a lot of stigma associated with it, all the more because, as Dr. Rekha rightly said, that there are a lot of people in the reproductive age category who are affected with this disease. So that the whole theme behind the World's AIDS Day celebration for this year is to equalize or to rule the ribbon. So there are plenty of measures being taken to make sure that there is no discrimination against these people, there is no stigma attached to the disease. And as a society, we need to make sure that we try to give them equal opportunities in everything. Any questions? Thank you.
Thank you all.